This is Brittany McGinness, and I will be filming my final head-to-toe physical examination. I'll do a scan of the room. My assessment tools here. Okay, and I'll have my patient enter the room now. And if you want to just take your shoes off and leave them off to the side for me. Okay, and you have a seat on the stool. My name is Brittany McGinness. I'm a nurse practitioner student with Auburn University, and I would like to complete a head-to-toe physical examination on you, if that's all right.
Yes.
Okay. So we'll get started with a few questions. Can you tell me your name?
Matthew McGinness.
Your date of birth?
10/4/85.
What's today's date?
April 8th, 2003.
And who's the president?
Joe Biden.
And what city are we in?
Auburn, Alabama.
Okay, so he is alert and oriented. I'm going to reposition this just a bit. I watched him as he entered the room, assessing his gait. It was steady and even. Can you tell me what you did yesterday?
I worked. It was Friday. Early morning, lunch, visited family in the evening.
Okay. So that's tested his recent memory. I'm going to give you 3 words to remember that I'll ask you to recall at the end of this session. Let's do Easter basket candy.
Easter basket candy.
Okay. So let's move on. We'll start checking your cranial nerves. I did perform hand hygiene before I entered the room while washing my hands. So we're first going to check cranial nerve number 1, which is the olfactory nerve. So I'll have you cover one side of your nose and breathe in and out, and do the other side. Okay. So were you able to move air pretty well?
Yes.
You can smell. All right. So I'm going to place a common smell underneath your nose with your eyes closed, and you tell me what it is.
Alcohol.
All right, that's correct. You can open your eyes. Cranial nerve number 2 is the optic nerve, and this tests your vision. So we do this by checking the visual acuity. Do you currently have any contacts?
No.
Do you normally wear any visual aids, glasses, or contacts? No. Okay. So I'm going to hold this eye chart. It's indicated 6 feet away. If you can cover one eye and read the lowest line you can see clearly.
LTFPH.
That's correct. That's 20/20 vision, so he can see at 20 feet what others can also see at 20 feet. If you can tell me this color here.
Red.
And this here.
Green.
That's correct. So color vision's intact. And we would check visual acuity of both eyes. We're just doing one for time's sake. Cranial nerves 3, 4, and 6 test the ocular movements. So that's the oculomotor, the trochlear, and abducens nerve. So I'm going to have you focus on this object. I'm going to move it in various positions, and you follow it with your eyes, but not your head. Don't turn your head. So he was able to follow the object in the 8 cardinal directions. I did not note any nystagmus at any point. Did you feel like you had double vision?
No.
So no diplopia present either. Cranial nerve 5 is the trigeminal nerve. We do that by clenching the teeth and feeling of the masseter muscle and also the temporal muscle. And I don't feel any abnormalities there, and it is symmetric. Cranial nerve 7 is the facial nerve. So I'm going to have you raise your eyebrows, close your eyes really tight, don't let me open them. Okay. Puff out your cheeks, and then show me your teeth. All right, so cranial nerve 7 is intact. Cranial nerve 8 is the vestibulocochlear nerve. So that is for hearing. So first we're going to do the whisper test. I'll have you cover this ear And I'm going to whisper a couple words if you'll just repeat them.
Purple hippopotamus.
That's correct. We'll also do the Weber test. I'm going to strike this tuning fork, place it on top of your head, and let me know if you can hear it in both ears or just one.
Both.
Okay, so that is the expected finding. We'll also conduct the Renee test. I will strike the fork again, and I'll place the base on your bone here behind your ear, and then you let me know when you can no longer hear it. I'll reposition it, and then you let me know when you can no longer hear it again.
Okay. Okay.
So that's the expected finding for the Renee test. The air conduction was longer than bone conduction. Cranial nerves 9 and 10 are the glossopharyngeal and the vagus nerve, and we check that by opening your mouth, saying ah. Okay, and we're checking for rise of the uvula, which that was the case here. That's the expected finding. We would also check the gag reflex, so I'd place a tongue depressor near the back of his tongue, and we would expect for him to gag. And then number 11, the accessory muscle, accessory nerve. If you can raise your shoulders, good, and then turn your head against my hand and against my hand, good, so that one's intact. And then number 12 is the hypoglossal, so if you'll stick your tongue out, move it left to right, and then raise it up for me. Okay, so that's intact. And then as I've been asking him questions, I've been listening to his vocalization, his articulation, and that's cranial nerves 5, 7, 10, and 12. So cranial nerves, I'll check out. So we'll just kind of start from the head and move down the body with the assessment now. I'm going to go ahead and feel around on your scalp, feeling for any bony abnormalities, any lumps or bumps, any tenderness that you feel.
No.
Okay, and I don't feel anything abnormal. Looking at the hair, it is a natural color. It appears to be clean, no signs of infestations, and no signs of hair loss. It's well dispersed. Looking at the eyebrows and eyelashes, they're intact and full. Looking at the face, everything appears symmetric. The eyes, can you smile for me? So the lips are symmetric, nose is midline, and ears are equal. I'm going to feel here on your pinna and the tragus, any tenderness there?
No.
Okay. I'm going to go ahead and feel of your sinuses here, the frontal, and then the maxillary. Any tenderness?
No.
Okay, and I'm just going to kind of tap on them. Any tenderness there?
No.
Okay. Go ahead and look in your ear with the otoscope. So I'm pulling up and back on the adult ear. Looking in the canal, I do see a mild amount of cerumen. I am able to visualize the tympanic membrane. It is pearly gray in appearance. No bulging or redness is present. There's a cone of light at approximately 5 o'clock on a clock scale, and I'm able to visualize the bony structures. Okay. And I would look into both ears in the clinical setting. Moving on to the eyes, we're going to check for pupillary constriction. So if you can just look past me, I'm just going to shine a light in your eyes and look for pupil constriction. So each pupil did constrict, and they constrict consensually, and we've already checked for accommodation. Looking here, shining the light at the nose, the corneal light reflex is symmetrical. Looking at the eyes overall, the sclera is white. The cornea is round and clear. The iris is hazel. Pupils appear to be 2 millimeters. The conjunctiva is pink. I'm going to feel here on your lacrimal ducts. Any tenderness there? Okay. Alright, let's take a look at your nose. So it's midline of the face. Tilt your head back slightly for me. Septum, there's no deviation there. The mucosa are pink and moist. I don't see any obstructions, and I am able to visualize the turbinates. And let me take a look in your mouth. Looking at the buccal mucosa, it's pink and moist, no ulcerations. Hard and soft powder intact. No coating on the tongue. Can you say ah for me?
Ah.
Okay. The posterior pharynx is not reddened. The tonsils are 2+, and I don't see any signs of postnasal drip. And then show me your teeth. And they appear to be intact. Gums do not have any signs of inflammation or bleeding. All right. Let me feel of your TMJ. Just open and close for me. Okay. No clicking or popping. Did you have any discomfort with that?
No.
All right. I'm going to go ahead and do an inspection of the internal eye. So just look past my shoulder. And I do see a red reflex. Looking at the fundus, I can visualize the retina, the macula, the optic disc. There's no cupping there, and the vessels appear intact with no nicking. If you can cover that eye, your right eye, I'm going to cover my left eye, and I'm going to bring my hand into field and let me know when you can see it. This is checking your visual fields.
Okay. 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 Okay.
All right. So we did see my hand enter the visual field at the same time, which is the expected finding. Let's move on down to the neck. Trachea appears midline. I'm going to come behind and feel up your thyroid. I don't feel any nodules there. I'm going to push it to one side. Go ahead and swallow. Okay, and so it was movable, and I would check both sides of that. I'm going to feel your lymph nodes now. Starting in the back, the occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, the posterior cervical chain, anterior cervical chain, supraclavicular, and infraclavicular. And I don't feel any inflammation there. Did you have any tenderness in any of those areas?
No.
Okay. All right. Let me feel of your carotid pulse here. Okay, so the rate is regular. I'd grade that as a 2+. Let's check your radial pulse. Again, normal rate, regular rhythm, 2+. I'll adjust the camera to see lower. If you'll just let your leg hang, check in the popliteal pulse. Posterior tibialis. As well as the dorsalis pedis. So I would grade those 3 as a 2+ and regular rate and rhythm. You go ahead and check capillary refill while I'm here. So that's less than 2 seconds, which is the expected finding. I don't see any edema in the lower extremities. I'll adjust the camera back up. We'll do a couple more neurological exams. If you could hold your arms out to the side, I'm going to have you close your eyes and touch your index finger to your nose on each side. Go ahead and do that for me with your eyes closed. Good job. All right, you can open your eyes. I'm going to have you now touch your nose and then touch my index finger in various positions. Good job. If you can put your hands on your thighs and just turn them back and forth. This rapid movement, that's good. Excuse me. I'm going to have you close your eyes. I'm going to place a familiar object in your hand and you tell me what it is.
It's a pen.
That's right. So that is stereogenesis. And then I'm going to draw a number in your hand and you tell me what it is.
It's an 8.
Okay, and that's graphesthesia. Alright. I'm going to check sensation in a couple places. I've got a soft and a dull object. I'm just going to touch you in various places with your eyes closed and you let me know if you feel it.
Soft. Soft. Dull. Dull. Soft. Soft. Dull. Dull. Soft. Dull.
Okay, so you got all of them correct except one, but I might not have put enough pressure, so that's okay. We'll do dull versus sharp this time and tell me where you feel it on your body. So left cheek, right arm, things like that.
Okay.
And sharp versus dull.
Sharp forehead. Dull left arm. Sharp right arm. Sharp right leg. Dull left leg. Dull right bottom leg. Sharp bottom foot.
Alright. So I missed one on that one too. Alright. We'll go ahead and start looking at the heart. We'll first check your carotids for any buries. Hold your breath for me. If you can breathe. There's no buries present there. I'm going to feel around on your heart first, just checking for any heaves or thrills. Okay, none present. So I'm going to listen to your heart in a few different places. I'm going to start in the second intercostal space in the right sternal border. That's the aortic. On the left sternal border, second intercostal space, that's pulmonic. Third intercostal space, left sternal border, is the Erb's point. Fourth intercostal space, left sternal border, is tricuspid. And then the fifth intercostal space, mid-clavicular line, would be the mitral. So I'm going to listen first with the diaphragm, and then you can just breathe normal. Listen with the bell now. Did not hear any abnormalities. I was able to hear S1, S2, no extra heart sounds, no murmurs. I would listen to that skin to stethoscope in the clinical setting, and I would be assessing the skin as I assessed each of these different areas. Overall, the skin appears dry and warm. The color is appropriate for ethnicity. Looking at the chest, for the respiratory system, He doesn't appear to be any respiratory distress. Have you had any shortness of breath lately?
No.
So his respirations are regular and even. I'm gonna just kind of look over your back as well, kind of feeling for any abnormalities. And I don't feel anything unexpected. Again, the back would also be disrobed for optimal assessment. I'm now going to place my hands on your back on each side. I'm going to have my thumbs around the 10th rib. And if you can take a deep breath in and out. And so that's checking for bilateral symmetric expansion, which it was. I'm going to go ahead and percuss the posterior thorax. Okay, and I did not hear any dullness or any abnormalities. I'm going to place my hands on your back. If you could say 99.
99.
Again.
99.
And again.
99.
Okay, so that's checking for tactile firmitus, which is making sure that the vibrations are felt equally bilaterally. And they were. I'm now going to listen to your breathing. I'm going to listen with the diaphragm of the stethoscope, but if I were to hear any abnormalities, I would repeat the same sequence with the bell of the stethoscope. Now, each time I move my stethoscope, if you'll just take a deep breath. You raise this arm up for me. Deep breath. On this side. Okay, I'll move around to the back. And again, this would all be done skin to stethoscope. Deep breath. So lung sounds are clear to all lung fields, anteriorly, laterally, and posteriorly. While I'm back here, we will be doing your abdominal assessment on the bed, but I'm going to go ahead and check on your kidneys. Have you had any issues urinating lately?
No.
Or any low back pain?
No.
Okay. Well, I'm going to tap on your back. Let me know if you have any pain. No?
No.
Okay. So that's checking for CBA tenderness. All right, let's do some range of motion. If you can, bring your chin down to your chest. That's flexion, and bring it back. Extension. Lean your head, your ear to shoulder, and the other side. That's lateral bending, and then rotation. Any issues there?
No.
Okay. I'm going to go ahead and feel of your joints in this upper extremity, and I'll just be doing one side for purposes of the video. Checking for any bony abnormalities, any fluid, edema, and I would be assessing the skin as well. Also checking for any areas of warmth. Wrist. Checking for any misalignment. And all that feels good. Was anything tender?
No.
Okay, we'll do some movement with the arm. So I'm going to have you raise your arm above your head. It's extension of the shoulder. Bring it back down. Go behind you. It's hyperextension. Bring it back in front. Come out to the side. Abduction and then down. Adduction. And then rotate out, external rotation, and back in, internal rotation. Any issues there?
No.
Okay, bring your arm out in front of you, checking on your elbow. If you can bend your arm, that's flexion. and extension. Turn your wrist over, your palm over, yep, pronation, supination, good. Your wrist, we're going to extend and flex, good. And then with your, we'll do out to the outside, or ulnar deviation, radial deviation. And then for your fingers, we're going to extend and flex and bring them back out. Spread them apart, abduction, and together, adduction. Good. Test your grip strength if you can squeeze both sides. Good. So equal grip strength there. Bring your arms up in front of you. Push against me. And don't let me pull. Good job. 5 out of 5 strength for the upper arms. And then we'll test your strength of your legs now too. Let's make sure this is in view. Right, just let your legs relax. Don't let me push you. And don't let me pull. Good. Alright, go ahead and stand up for me. And we'll move this stool out of the way. If you'll, actually let me look at your spine first. If you can turn and face that wall. I'm just going to feel for any misalignment or any abnormalities, and that feels okay. Can you bend forward for me? Feeling again, this flexion of the spine. Stand back up, lean backwards. This extension, any problems there?
No.
Can you, to your side, kind of reach down towards your foot, and the other side, that's lateral bending of the spine, and then if you can twist your upper torso. Good. Alright, go ahead and stand over by the wall for me. I'm going to have you put your feet together. Make sure we're in view. Okay. I'm going to have you close your eyes, and we're just checking your balance here. And I'm right here if you follow. Alright, you can open your eyes. So this is the Romberg test. I would observe this for a full minute. He would fail the test if he fell. Next we'll do some walking. So I watched you walk in the room and that gait was even and steady. So now I'll have you walk heel to toe towards me. Okay, you can stop. Turn around and go back the other way, walking on the balls of your feet, kind of tippy toe. Alright. And then now stand on one foot. Hop in place. Good job. And then come back to me walking on your heels, kind of like a duck. Good. So you got good balance and coordination. Go ahead and sit on the edge of the bed for me. We're going to check your reflexes. Alright, so your arm, if you can let me see that and just let it hang. I'm going to check your triceps. And I saw a little movement there in the hand. We're going to turn this over, check your brachial. And I saw some movement there in the thumb, and then, or sorry, that was your biceps. And then the brachial radialis. And there's reflex in the hand. We're going to look at your patellar reflex here. Scoop forward just a little bit so it's hanging. There you go. Good, and we had reaction in the foot, and then also looking at the Achilles. And there was some reaction in the forefoot. I'm going to run this along the bottom of your foot. Are you ticklish? Okay. Alright, good job. So we were looking for lift of that toe, which was not there, so that was a good sign. Let me go ahead and can you run this heel down this shin and back up? All right, good job. So I would check the reflexes on both sides of the body and have him do that with the heel to shin on both legs. So now we're going to talk about the self-breast exam. So breast cancer is a lot more common in females than males, but it can happen in males. So you would want to check this monthly by doing 2 different positions. So one you can do with your arm up and behind your head, and then you'd want to feel the entirety of the breast up into the armpit, into the tail of Spence, because you can have enlarged lymph nodes there, so you can relax your arm. So you would feel that in either a circular, zigzag, or wedge pattern. And you can do that in the shower because the moisture makes it easier to do. And then you'd also want to do it lying down in the same position. You'd also want to look at the symmetry, so you would stand in front of a mirror, hands on your hips, and lean slightly forward. You're looking to see if they're symmetric in size and shape. You're looking for any dimpling, any skin discolorations, that your areolas appear the same, no color change there, no nipple discharge. Also want to make sure there's no orange peel appearance in the breast. In the clinical exam, I would conduct it very similarly. I would have him, do both positions. If my patient were a female, I would educate her to conduct the self-breast exam at the same time every month due to changes in the breast tissue throughout this cycle. I'll go ahead and have you lie down. We're going to look at check your neck for any jugular venous distension. And I don't see any present. I'm going to also press on your liver here, looking for hepatojugular reflex. And that is not present. I'm going to go ahead and listen to your heart again. And the same 5 areas. And also with the bell. Again, that would be skin to stethoscope. I did not hear any abnormal heart sounds again at this time. S1, S2, the rate was a little bit quicker, but that's expected from all your duck walking and hopping on your one leg. To look at the abdomen, you would be disrobed. I'm looking for any pulsations, any discolorations, bruising, herniations. I'm going to feel here for the aortic pulse. I'm not able to feel it. I could also feel for the point of maximal impulse at that 5th intercostal space, mid-clavicular line, if I had him turn and lie on his left side. Next, I'm going to listen to the abdomen. This would be skin to stethoscope. Listening to all 4 quadrants. Bowel sounds are active. I'm going to listen to the aortic artery. Renal artery. And the iliac. I did not hear any bruise, and I would listen to that bilaterally. I would also palpate and listen to the femoral artery, but for modesty reasons, we're going to skip that. I'm going to now percuss your abdomen, so I'm listening for any areas of dullness. Okay. And now, do you have any pain in your belly right now?
No.
Have you ever had any surgeries?
No.
Okay, so I'm going to just do some light palpation. Any issues there? Okay, I'm going to do a little deeper with the palpation. Okay, any problems there? Okay. I could also check for the abdominal reflex. If he were disrobed, I could run the end of my reflex hammer along the abdomen and just look for his belly to jump like as the reflex. I'm going to percuss now your liver, checking for liver size, so starting at the umbilicus. About right there, and then coming down in between the ribs. So the liver is about 9 centimeters with the percussion. We're going to check out your lower leg. Any injuries to the leg or any problems with the joints?
No.
Okay. I'm going to feel the hip here. Just checking for any bony deformity, fluid edema, or any discolorations. Looking at the skin all the way down. Feeling of the knee joint at all the different ligaments. Down to the ankle, the foot, and toes. All right, so let's do some movement here with your leg. So go ahead and bend your knee, bring your leg off the bed, and then extend it out. So that's flexion and extension of the hip. Bring your leg out to the side. That's abduction, and together is adduction. All right, and then we also observed flexion and extension of the knee with that movement. Go ahead and bring it back up, bring it out to the side. That's external rotation and internal rotation of the hip. You can relax it. Looking at the ankles, if you can push the gas pedal, that's extension, bring it back is flexion. Turn your feet in, inversion, and out, eversion. And then with your toes, if you could curl them, that's flexion. And bring them out, that's extension. Good job. All right, I'll have you go ahead and sit up on the side of the bed. If I told you this room was on fire right now, what would you do?
I would leave.
Good answer. So his mood and affect has been appropriate throughout the exam. If you could tell me the 3 words that I asked you to remember in the beginning.
Easter basket candy.
That's right. Well, this concludes our exam. Thank you so much.
Ready?